The Body Shop with Meredith McDonough and Dr. Steve is brought to you by Allegheny Chesapeake Physical Therapy.
Good evening and welcome to this week's edition of The Body Shop with Dr. Steve. I'm Meredith McDonough, and this week's topic is ACL tears. And everyone at home may be wondering what ACL stands for, so Dr. Steve is going to fill us in and tell us.
Okay, Meredith. ACL is an abbreviation for Anterior Cruciate Ligament, and that's a knee ligament that's dead center in the knee.
It seems these injuries have become extremely common. How big a problem is this?
Actually, in the United States, for females, there's 38,000 anterior cruciate ligament injuries annually.
Wow, that's a lot.
That is a lot.
One too many, huh?
One is too many. Yeah.
Okay, Dr. Steve.
Especially if it's your knee.
Dr. Steve, can you show us where the ACL is exactly on the knee model and really why this ligament is so important to the knee?
Sure. This is the thigh bone or the femur. This is the tibia. We've peeled away all the skin, all the fat, all the muscle, and we're left really with just the ligaments of the bone. This is your kneecap. If I pull the kneecap out of the way and I bend the knee a little bit for you, you can see right there,
so
that
right
ligament. That's the anterior cruciate ligament.
It's like hidden back there.
It is. It's sort of a central cross inside the knee. Obviously, most people can't even imagine where that is, but it's so critical that if you don't have it intact, attaching both of those bones, you frequently can't walk or run or participate in sports.
Okay, now some injuries, you can heal on your own. Can the ACL, will it heal on its own?
Unfortunately, it doesn't. Once it's torn, it doesn't heal. It scars down, but it becomes incompetent. It doesn't really serve its purpose. It serves the purpose of keeping the top bone from sliding too far forward or back. It sort of stops this motion of the leg. And without that ligament intact, it doesn't heal back to be able to do that.
Okay. So Dr. Steve, I guess a lot of people are probably wondering, especially female athletes, what advice can you give them?
The best advice I can give them is before they participate in a sport that has a ballistic or uncontrolled movement, which is sort of the basketball, running, those kinds of things, skiing, make sure you're fit, make sure you have the right equipment, make sure you're flexible, and don't push it. You don't want to take that last run down the slope. You don't want to play one more game. You want to sort of knock it off when it's safe, and then make sure you're good and strong.
All right, so thank you very much, Dr. Steve. I think now we all know how to take care of our knees a little better. Don't push it, right? And make sure we're nice and strong before we hit the courts or hit the slopes, right?
That's right.
All right, guys, you heard him. If you have any more questions for Dr. Steve, all you have to do is give him a call at 1-800-332-5740 or log on to www.alleghenychesapeake.com, and Dr. Steve will help you out.